My name is Rebecca, and I'm a wife and mother of 3 beautiful children. My youngest child, Hana, was adopted into her forever family when she was 8 months old from South Korea and was diagnosed with central precocious puberty, also known as CPP. Prior to the adoption of Hana, my career was as a registered nurse in the neonatal ICU. After Hana's diagnosis, I became intrigued and wanted to learn more about endocrinology, so I have been practicing for the last 5.5 years as an endocrinology nurse. My reasoning for sharing Hana's story is to help other families dealing with a new diagnosis of CPP for their child. I remember when Hana was diagnosed, the fear and anxiety, was very overwhelming. Now that she's on treatment and I can share her story, will encourage families to know that CPP is a condition that can be treated. When Hana was around 2 years old, we began to notice changes in her breast area, and I initially, for a brief second, thought she was developing breasts, but didn't know about central precocious puberty at the time, and so therefore was in denial and just reassured myself it's just baby fat, it'll go away, this can't be breast development. And so I just watched and waited, and it was when her left breast started increasing in size that I knew something definitely wasn't right. So we called her pediatrician and brought Hana in for a visit. When I took Hana to the pediatrician, she was very calming and very reassuring to us, just letting us know that we would get to the bottom of things and Hana would be well taken care of. So she began by ordering just basic blood work, an LH, FSH, and estradiol, and then she also ordered an x-ray of Hana's hand to help determine her bone age. The blood work came back normal, but her bone age came back as advanced. So it was because of these results Hana was referred to a pediatric endocrinologist, and we had her first appointment. And again, the pediatric endocrinologist was very reassuring with us, but decided to order a leuprolide stimulation test. This testing was about a 2.5-hour process where an IV was placed and a series of blood draws were taken to assess her LH, FSH, and estradiol levels. The results took about 2 weeks, and the results came back showing an elevation of her LH and estradiol and FSH, leading to the diagnosis of central precocious puberty. When Hana was first diagnosed with CPP, I went online and did my research to understand her condition and treatment and set expectations for this journey. After doing that research, I gained a better understanding of the condition, better understanding of what to expect as far as treatment. There were numerous questions in the beginning that were left unanswered. I could go on and ask questions of other parents who are further along in the journey, and that was definitely a very helpful resource for me. When Chong and I initially found out about Hana's diagnosis of CPP, we were really overwhelmed and just fearful.
Well, I just didn't know enough about it. I was almost in denial. I just didn't understand it. It was all new to me. And her being so young, and if there was treatment, just so that we can get her some help.
After we did our research on CPP and gained a better understanding of central precocious puberty, we felt like we could share with our friends and family Hana's condition. We felt like we couldn't immediately tell our friends and family when we didn't even really know how to understand it. So therefore felt like we couldn't explain it. After that research and having a better understanding, as we told friends and family, we got so many different reactions, but the most common was, what is that? I've never heard of that. How could a child so young be going through puberty? And, that faced a challenge to try to answer those questions because there's many times where you just don't have the answer. SUPPRELIN LA has just become part of a routine for us. Very matter of fact, and we know it's temporary. This will end probably when she's around 11 years old. We made the decision to start Hannah on SUPPRELIN LA after information received by her pediatric endocrinologist. Her pediatric endocrinologist informed us of this once-yearly implant that is effective in suppressing hormones after the first month of therapy for 1 whole year. And this decision just seemed advantageous for our family and Hannah and our lifestyle. We had done our research on SUPPRELIN LA, knew what to expect, and Hannah's pediatric endocrinologist did an amazing job at telling us about expectations, that during the first 4 weeks of therapy, we might see an increase in the signs of puberty, but that should go away by the end of that 4th week. We knew that she would need something of comfort to take with her. I knitted her a blanket, which she became very attached to immediately when coming home to her family. And so on her implant day, she took that blanket with her, and that was her source of comfort. Up until age 5, she realized she was a big girl and she was brave and she no longer needed her blankie on her medicine day. So before her first implant, we just explained she would be getting a special medicine in her arm, and that medicine would help prevent her body from changing too fast. Each year we've adapted the way we communicate her medicine day, and we answer the questions that she has based on her age and developmental level. Hannah has her SUPPRELIN LA implant placed by a pediatric surgeon each year, and the procedure is typically fairly short, and she takes it in stride. She's a trooper each year. With Hannah, we know the SUPPRELIN LA is managing her CPP, and we know this because we continue with our follow-up appointments with the pediatric endocrinologist, and we do blood work throughout that time frame to ensure that her levels are at an appropriate amount. Her pediatric endocrinologist expects Hannah to be on the SUPPRELIN LA implant until about age 11. For most children, girls will stay on SUPPRELIN LA implant until age 11 and boys until age 12, when the expected normal time of puberty begins. As Hannah's treatment with SUPPRELIN LA finishes, she will no longer need to be managed for CPP. She will continue her annual well child exams and be expected to go through puberty at the normal time that a child should go through puberty. I stress the importance of maintaining follow-up appointments with your child's endocrinologist. This will help them determine that the SUPPRELIN LA implant is working for your child. They will do this by measuring your child's height at each visit, assessing the pubertal status, and also by ordering an X-ray to determine your child's bone age. We're seeing more and more children coming to our endocrinology clinic and receiving a diagnosis of CPP. And it's our job as professionals to help educate the parents and children on this condition, provide them resources they need to help determine which pathway is appropriate for their family in managing this condition of CPP. For our patients that have newly been diagnosed with CPP, we discuss the various treatment options, and among that discussion includes side effects. The most common side effects for SUPPRELIN LA include bruising, pain and soreness, swelling, itching, and tingling at the insertion site. The side effects of SUPPRELIN LA usually go away on their own within 2 weeks, but we always tell our families if their child has redness, pain, or bleeding at the insertion site to contact our office immediately. In my profession as a pediatric endocrinology nurse, we're seeing more and more families coming to us with children between the ages of 5 and 6 getting diagnosed with CPP. And they present us fearful of the unknown because they're uneducated on CPP. I'll use this opportunity and share Hannah's story and our journey with central precocious puberty. It provides them a sense of reassurance. As a nurse, when a patient is diagnosed with CPP, I will provide counseling on the risks and benefits of the once-yearly SUPPRELIN LA. After this discussion, I will provide them with literature to take home and have ample time to review so they fully understand the path that they're headed on. The SUPPRELIN LA implant is a fairly short procedure. An area in the upper arm is numbed and a small incision is made, and the implant is placed directly underneath the skin. After the implant is placed, the incision will be closed with either sutures or surgical strips depending on the surgeon's preference, and then a pressure bandage would be placed over top of the incision. After the SUPPRELIN LA implant is placed, I instruct families the importance on keeping the incision site clean and dry, and that would include no swimming or bathing for 24 hours after the placement of SUPPRELIN LA. And then I would also instruct families to avoid heavy play and exercise for 7 days after the implant is placed. It's important to keep an eye on the insertion site after SUPPRELIN LA implant has been placed. There have been very rare cases of the implant ejecting from the site without the child noticing. After the incision site's been healed, the child can resume all normal activity. The information I provide to patients and families that are dealing with CPP is vital. The resources I provide to families helps point them in a direction to understand their child's condition. I feel like in the pediatric medical community, there is limited education and resources available, and that is something that needs to be increased. In my journey with Hana, there were many resources that helped me along the way. I researched central precocious puberty online and found numerous resources that provided me with education, expectations, and support. I even found a support group on social media that I could belong to, where in the early stages when I had a lot of questions, I was able to bounce those off of other parents going through the same thing. As a nurse who coordinates the SUPPRELIN LA implants for our practice, I have had numerous families take advantage of the SUPPRELIN LA Shares program. These families who are eligible and have a copay for SUPPRELIN LA have been able to pursue treatment and alleviate any financial burdens associated with it. Hana's diagnosis with CPP has changed my life, both personally and professionally. When we adopted Hana, we had no idea she'd be diagnosed with CPP. And looking back, I also think if it weren't for Hana, I would still be working in the neonatal ICU and would not be able to help families in the pediatric endocrine world. Hana is our gem. She is truly one amazing gift.
She just loves her friends and school and just loves playing, and she's just a special little girl.
She is just your typical 7-year-old.
She brings joy to our lives every single day.
She loves to eat ice cream. She loves to do arts and crafts and paint and go to the park. It's truly this gift that we've been blessed with that has allowed me to help other families going through the same journey. And it's because of Hana that I am going to give back to the patients and families of the pediatric endocrine community.
What is SUPPRELIN LA? SUPPRELIN LA is an implanted gonadotropin-releasing hormone, GnRH, medicine used for the treatment of children with central precocious puberty, CPP. It is not known if SUPPRELIN LA is safe and effective in children under 2 years of age. Important safety information about SUPPRELIN LA. SUPPRELIN LA should not be taken if your child is allergic to gonadotropin-releasing hormone, GnRH. GnRH agonist medicines, or any ingredients in the SUPPRELIN LA implant, or is pregnant or becomes pregnant. SUPPRELIN LA can cause birth defects or loss of the baby. If your child becomes pregnant, call your doctor. In the first week of treatment, SUPPRELIN LA can cause an increase in some hormones. During this time, you may notice more signs of puberty in your child, including light vaginal bleeding and breast enlargement in girls. Within 4 weeks of treatment, you should see signs in your child that puberty is stopping. Some people have had implant breakage during the removal process. Some people who had SUPPRELIN LA placed in their arm have had the implant come through the skin, extrusion. Call your child's doctor right away if the SUPPRELIN LA implant comes through the skin. Some people taking GnRH agonists like SUPPRELIN LA have had new or worsening mental, psychiatric problems, including depression. Mental, psychiatric problems may include emotional symptoms such as crying, irritability, restlessness, impatience, anger, and acting aggressive. Before your child receives SUPPRELIN LA, tell the doctor if they have a history of mental problems. Call your child's doctor right away if your child has any new or worsening mental symptoms or problems while taking SUPPRELIN LA. Some people taking GnRH agonists like SUPPRELIN LA have had seizures. The risk of seizures may be higher in people who have a history of seizures, epilepsy, brain or brain vessel, cerebrovascular, problems or tumors, or who are taking a medicine that has been connected to seizures such as bupropion or selective serotonin reuptake inhibitors, SSRIs. Seizures have also happened in people who have not had any of these problems. Before your child receives SUPPRELIN LA, tell the doctor if they have a history of these problems, as well as all the medicines they take. Call your child's doctor right away if your child has a seizure while taking SUPPRELIN LA. Severe cutaneous skin adverse reactions can happen during treatment with GnRH agonists like SUPPRELIN LA. Stop SUPPRELIN LA and call your child's doctor right away if your child has any of the following signs or symptoms during treatment with SUPPRELIN LA: skin rash or acne, blisters or sores in the mouth, dry skin, peeling of the skin, itching, fever, blisters on the skin, muscle or joint aches, redness or swelling of the face, hands, or soles of the feet, and or swollen glands. Increased pressure in the fluid around the brain can happen in children taking GnRH agonist medicines, including SUPPRELIN LA. Call your child's doctor right away if your child has any of the following symptoms during treatment with SUPPRELIN LA: headache, eye problems, including blurred vision, double vision, and decreased eyesight, eye pain, ringing in the ears, dizziness, nausea. Your child's doctor should do tests to make sure your child has CPP before treating with SUPPRELIN LA. SUPPRELIN LA lasts for 12 months. One implant will give the medicine for 12 months. After 12 months, SUPPRELIN LA must be removed. The doctor may insert a new SUPPRELIN LA at this time to continue treatment. SUPPRELIN LA is placed under the skin of the inside of the upper arm. The doctor will numb the arm of your child, make a small cut, and then place SUPPRELIN LA under the skin. The cut may be closed with stitches or surgical strips and covered with a pressure bandage. Your child should keep the arm clean and dry and should not swim or bathe for 24 hours after receiving the SUPPRELIN LA implant. The bandage can be removed after 24 hours. Do not remove any surgical strips. They will fall off on their own in a few days. Your child should avoid heavy play or exercise that uses the implanted arm for 7 days. You and your child should routinely check the insertion site until the cut is healed. After the cut has healed, your child can go back to his or her normal activities. The doctor will give you complete instructions. Keep all scheduled visits to the doctor. Your child's doctor will do regular exams and blood tests to check for signs of puberty. Sometimes the doctor will have to do special tests, such as ultrasound or MRI, if the SUPPRELIN LA implant is difficult to find under your child's skin. The most common side effects of SUPPRELIN LA are skin reactions at the place where the implant is inserted. These reactions may include pain, redness, bruising, soreness, and swelling in and around the implant site. Call your child's doctor if your child has bleeding, redness, or severe pain where the implant was inserted. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit MedWatch or call 1-800-FDA-1088. Please see full prescribing information, including medication guide.